everyone, and thank you for joining today's NeedyMeds special topic webinar, Lupus 101, presented by the Lupus Foundation of America. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started, I'd like to go over a few tips so you can make the most out of today's presentation. First of all, if you have questions throughout the presentation, you can feel free to type them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you personally via email. But of course, we also recommend that you can reach out to either NeedyMeds or the Lupus Foundation of America, and I will provide the contact information for both of our organizations also at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find the PowerPoint slide decks that we're using in the handout section of your control panel. So let's get started with what is NeedyMeds. For those of you not familiar with us, what you're looking at on your screen now is all of our fancy wording about our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. So one of the things that I'd also like to show you, and I really like to put up a screenshot of our homepage. And the reason I do that is because it gives me an opportunity to just share some of the resources that NeedyMeds has that I think you'd be interested in it. Obviously, I encourage you strongly to go ahead and check out our website further when time allows. In the meantime, if you are looking for healthcare cost savings, you will begin your search under that Patient Savings tab. The Advocates tab is where you will find our educational information. You can sign up for webinars, our monthly newsletter called Vitals, and order some of our educational materials and brochures, for example. I mentioned that today's webinar is being recorded, and you'll be able to find that recording on our YouTube channel, which is at the top right of our homepage with the rest of our other social media icons. It's the third one from the left. And you can also see other upcoming webinars and register for them on the calendar of events on the bottom right hand of our homepage. I'm also pleased to let you know that we just put together a new section on our website, the COVID-19 Resource Center. You can see it right on her homepage, or you can get to it by clicking on that Patient Savings tab, and then you'll see it right in the middle. You can search by what's available in your area, by the name of the program if you know that, or by the area of service, meaning where what programs are available where you live. And this resource center helps connect people to programs that will assist them if they are experiencing financial hardships or struggling with healthcare expenses due to the pandemic. So with that, let's move on with today's presentation. As you saw on the screen earlier, the screen that showed the NeedyMeds mission statement, a big part of our mission is education. And we really define that in two ways: by educating people about NeedyMeds and the resources we offer, by also letting them know about other reputable organizations that can help them if they're living with a particular diagnosis, which is why we are so pleased to have our guest from the Lupus Foundation of America here with us today, Ashley Holden. So first, let me tell you just a little bit about the Lupus Foundation of America. They are the largest publicly supported lupus organization devoted to solving the mystery of lupus, one of the world's cruelest, most unpredictable, and devastating diseases. Through a comprehensive program of research, education, and advocacy, they lead the fight to improve the quality of life for all people affected by lupus. So now let me tell you a little bit about our guest, Ashley Holden. Ashley is a health educator at the Lupus Foundation of America's national office. Ashley received a Bachelor of Science degree in Public and Community Health from the University of Maryland and a Master of Education in Health Education from the Pennsylvania State University. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. So since May is Lupus Awareness Month, as those of you that are joining us probably know that lupus is a chronic autoimmune disease that can damage any part of the body and can mimic many other illnesses. So in honor of Lupus Awareness Month, today Ashley is going to discuss the basics of lupus and how to get you connected with the resources that you need. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Ashley. So bear with me while we do that. And as Ashley is grabbing the screen, I do want to remind everybody again that if you do have questions throughout Ashley's presentation, you can feel free to type them into that question section of your GoToWebinar control panel. And with that, I'll pass the mic to Ashley. Thanks, everybody, and enjoy today's presentation.
Thank you, Carla. Are you able to see my slides before I get started?
Perfectly. Thanks for checking, though.
Thank you so much. Well, I am so happy to be here this afternoon or morning, depending where you're at. And as Carla mentioned, at the Lupus Foundation of America, or you may hear me call it the LFA, during my presentation, our mission is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. And as she also mentioned, it definitely is Lupus Awareness Month. So all of May is Lupus Awareness Month. There's also World Lupus Day, which is May 10th, and we just had Put on Purple Day this past just a few days ago. So lupus awareness is huge because the majority of Americans ages 18 to 34 know very little about lupus. And it can take quite a long time for someone that suspects they have lupus to actually get an official diagnosis. On average, it could be 6 years to receive that official lupus diagnosis. And a lot of the time, someone may have to see multiple doctors before they're able to get that diagnosis or find a doctor that's willing to work with them, regarding the symptoms that they have. And so, having low lupus awareness really does result in late diagnosis, and it can lead to increased disease activity and severity, as well as even cost, while people are trying to kind of figure out what's going on. So before we jump in about, talking about lupus, I think it's always important to talk about different ways to get involved with us at the LFA if you're interested. And really, there's a lot of different ways that you can do that, barring what's going on with the coronavirus. But we typically have walks across the country, and we have worked on rescheduling those. So we're hoping that hopefully this fall we can have our walks. You can also become an advocate, and there are also a variety of different fundraising opportunities as well. There's also always the opportunity to share people with lupus to share their story with us. So again, there's a lot of different ways to get involved with us, whether it be an advocate, walking with us, sharing your story, or doing some type of fundraiser. It could even be a fundraiser that is kind of your own idea with our Make Your Mark program. We also have a variety of different programs and services. The first one that you'll see in the top left box is the National Resource Center on Lupus. And that's your one-stop shop to find all of the up-to-date resources and information on lupus. Our website is lupus.org, or you can visit resources.lupus.org in order to visit that National Resource Center on Lupus. We also have the expert series, and we recently changed the format of this, so it is now a monthly educational podcast, and it features empowering presentations from leading lupus experts with a focus on helping people with lupus live well. We have Lupus Connect, which is our online community where people can engage and connect with others, share experiences, find support, and share practical insights for living with lupus. We also have Take Charge, and that is an educational series designed to help individuals take charge of their lupus. And over the course of 8 weeks, people with lupus will receive a weekly email from our health educators with self-management tips, resources to empower them with knowledge and skills to better manage their lupus. We also have the National Health Educator Network, and that is what I am part of as one of the health educators with the LFA. We have a team of us. We have a nurse, and we also have certified health education specialists such as myself that are available to answer questions and provide education about lupus. One important thing that I really do want to point out about the National Health Educator Network is that we do have a bilingual health educator who speaks Spanish. So we're available by phone, and we can also correspond by email. The email questions are a little bit easier for us to get a response to quicker. We, of course, make every effort to return phone calls as quickly as we can, but sometimes they do take a little bit longer than if we were to respond by email. Especially during high volume times such as Lupus Awareness Month, or you may have seen a popular lupus medication in the news given the coronavirus. So we were experiencing high volume questions during that time as well. We also have a questionnaire. So if you are questioning if you have lupus, if you know someone that is questioning if the symptoms that they have could be lupus, you can use that questionnaire to find out if those symptoms could be related to lupus. And I always share with people that you can print those results and use them as kind of a talking point outline to talk to your doctor about those symptoms you're experiencing. We also recently launched Inside Lupus Research, and that's a one-stop shop for a lot of different research, whether it's medication research or latest updates about medications, just a lot of different things about clinical trials, like I said, treatment breakthroughs, whatever it may be. There's a lot of good information there. So what is lupus? And I think before we dive in, I think it's important to note that there are different types of lupus, and we're going to talk about each of these a little bit more in depth as we go. But I just kind of wanted to show you the breakdown before we move forward. So there's systemic lupus erythematosus, and that is usually what is commonly referred to just as lupus. And that's the majority of lupus cases are going to be that systemic lupus or SLE. There's also cutaneous lupus, and that is also referred to as skin lupus. There is drug-induced lupus, and there's also neonatal lupus, which is not a true form of lupus, but we'll talk about that in a little bit as well. So, and Carla talked a little bit about this in the beginning, but lupus is a chronic autoimmune disease that can damage any part of the body, such as the skin, joints, or the organs. And chronic means that signs and symptoms may last for many years or may not go away at all. So in lupus, symptoms typically come and go. They may not be present all the time, but that doesn't mean that someone without symptoms doesn't have lupus anymore. So it's not curable. It is treatable, but not curable. And lupus, one of the things that makes it somewhat difficult is that it is different for each person. So you could put 5 people in a room with lupus, and they may all be experiencing symptoms differently from each other. And again, it's unpredictable. So those symptoms really range. And lupus is characterized by periods of inflammation or flares, and then there's also times of inactivity or remission. It's really important to recognize that lupus is not related to cancer. It's not contagious, and it's not like or related to HIV, the human immunodeficiency virus, or AIDS. So it's completely different from those, and it's completely different from cancer as well. So we don't know exactly what causes lupus, but many scientists believe that lupus develops in response to a combination of factors, both inside and outside of the body. And so it's a complex interaction likely of hormones, genetics, and the environment. And most researchers today think that an environmental agent randomly encountered by a genetically susceptible individual acts to trigger the disease. So this person is already, again, genetically susceptible. They're likely to get lupus. And then there's some type of factor that might set that off, whether that's a virus or maybe they're exposed to something. It kind of may trigger that chain of events for them. So the majority of people that get lupus are female, but lupus can develop in anyone at any time. So it can be in a male, female, it could be in someone that's of any age, including children, teenagers, and adults. But lupus does mostly strike women of childbearing age. As far as it goes, is looking at these numbers, we estimate that there's about 5 million people worldwide affected by lupus, but it's not easy since lupus itself is not easy to diagnose and it's not a reportable disease. It's difficult to capture all of the cases reliably. And so our best estimate, as I mentioned, is 1.5 million in the US, 5 million globally. And then our best estimate is about 16,000 new cases of lupus reported each year. The Centers for Disease Control and Prevention funded several population-based patient registries to better estimate how many people have doctor-diagnosed lupus in certain racial and ethnic groups. So we're hopeful that we'll be able to get better numbers in the future as far as who actually has lupus and have some better statistics. So again, who is at most risk? Again, it's going to be your female. Women are much more likely to develop lupus. As far as age, most people are diagnosed between the ages of 15 to 44. There are a small percentage of cases here that show that people can be diagnosed during childhood as well. Lupus is also 2 to 3 times more prevalent among women of color. And when I say women of color, that would be African Americans, Hispanics and Latinos, Asians, Native Americans, Alaska Native, Native Hawaiians, and other Pacific Islanders. And then we also here have family history. So relatives of people with lupus have about a 5 to 13% chance of developing lupus. And then also just another kind of little statistic for you is that only about 5% of children will develop lupus if their mother has it. So a lot of times we'll hear from people that say, my mom had lupus, well, I definitely get it. So research shows about 5% of those children will go on to develop lupus if their mother has it. So I mentioned that women of color are more likely to get lupus than others. And I just wanted to mention that there was a study called the Lumina study, and that looked at lupus in minorities, nature versus nurture. And that showed that people that were Hispanic and African American lupus patients were likely to have more severe disease activity overall. They're having more severe organ involvement. They may develop lupus later in life. Again, they are going to likely experience greater disease activity as it is at the time of diagnosis, so kidney problems. And there may also be a greater likelihood of neurological problems, including seizures, internal bleeding, and strokes. So lupus can affect almost any part of the body. And again, we're mostly talking about systemic lupus here. And I won't go through each one of these items listed on this diagram, but just so you know, you can really see that lupus has a wide range of different parts of the body that it can affect, whether it be, gastrointestinal issues. It could be musculoskeletal problems. So a lot of people will have a lot of pain, joint pain. There can also be kidney involvement. A lot of people are familiar with lupus nephritis. There was a celebrity that was in the news that had a kidney transplant in the last couple of years. That may ring a bell for you. And like I said, she had lupus and had that transplant. So there's a lot of different things that can occur with lupus. And that wide range, again, sometimes makes it kind of difficult to narrow down what's going on within an individual, since so many of these things can really imitate other diseases as well. As far as the economic impact of lupus, a lot of people with lupus end up not being able to work full time due to lupus complications. You can see up here that's about 89%. And since a lot of those people can no longer work full time, a lot of lupus patients do receive their health benefits through government-sponsored programs such as Medicare and Medicaid. And again, those with lupus are going to be at the doctor a lot more than others. They tend to have about 3 times more doctor's visits than those without lupus. Okay, so I said that we would get to this, talking about the different types a little bit more. So again, when we talk about that lupus, a lot of people are referring to systemic lupus erythematosus, SLE, and that's the most common form of lupus. And think back to that diagram that we just looked at that showed those different body parts that can be affected. So a lot of different things can be impacted with SLE. Common symptoms would be fatigue, hair loss, being sensitive to the sun. Sometimes you'll hear that be referred to as photosensitivity, having those painful and swollen joints, unexplained fever, skin rashes, and kidney problems. I also mentioned that some people can be diagnosed in childhood. And so when lupus is diagnosed in childhood, it does tend to be more active and does tend to have more serious outcomes, unfortunately. And so 15 to 20% of lupus diagnosed in childhood tend to have greater lupus nephritis prevalence among those that are diagnosed when they're children. Most children will be diagnosed between the ages of 12 and 14, but it could really occur at any age during childhood. We also have cutaneous lupus, so that's that skin lupus. A lot of symptoms would include rashes or lesions. It could be hair loss if somebody has those lesions on their scalp, vasculitis, ulcers, and that photosensitivity, which I mentioned. So that's where someone is very sensitive to UV light. So that could come from the sun, or even different types of light in the house can produce UV rays or UV exposure as well. There are different subtypes of cutaneous lupus. So there's acute cutaneous lupus, discoid lupus, and discoid lupus can develop into systemic lupus as well. And then the third type is subacute cutaneous lupus. So I think it's important too to realize that someone that has skin involvement can also have SLE. But there are people that their involvement is just limited to their skin. So just because someone might have SLE doesn't mean that they wouldn't have skin involvement. It just kind of depends on how it's affecting them systemically. And here's just a couple of examples of cutaneous lupus. So that first picture on the left side shows you what most people know is that malar rash or the butterfly rash. Most people that have a butterfly rash, usually by the flares of their nose, that will remain white. It's not typically affected with a lupus butterfly rash. And then we have subacute cutaneous lupus here in the middle, so you can see some of those lesions. She has them in her face and she has them on her chest, so mostly where the sun would be able to shine. And then finally on the right side is the discoid lupus lesions, and you can see that we're showing the scalp here, and that's leading to some hair loss that you can also see depicted there. Another type is drug-induced lupus. And so this, again, is not going to be a true form of lupus in itself. It's basically a side effect of long-term use of certain medications. And these medications will cause a lupus-like disease. And the symptoms can include joint and muscle pain, arthritis, flu-like symptoms, even potentially inflammation in the heart and lungs. But they rarely cause any kind of lasting damage to the organs if it's drug-induced lupus. There are most common drugs associated with drug-induced lupus are certain blood pressure medications, as well as medications used for tuberculosis. However, there are at least 46 drugs that have been known to cause drug-induced lupus, and that list does potentially have the potential to grow as we learn more about different medications and the symptoms that they produce. Drug-induced lupus, when those medications are stopped, the symptoms go away, usually within 6 months of stopping that medication. If someone stops that medication and it's been past 6 months and they're still experiencing symptoms, they should likely go back to their doctor and see if there's something else going on since that medication's been stopped or changed to a different one, to see if there's another underlying cause going on there. So then neonatal lupus. As I mentioned, this is not a true lupus. It's a rare condition that occurs in infants, and they're born to a mother that has, and it's caused by certain antibodies, but that doesn't mean that the mother that baby was born to has lupus. So neonatal lupus can cause some heart issues, whether it be heart block, neonatal rash. It can be fatal if it's not caught early enough and some of those things addressed, especially if there's heart issues going on. But really, it's, again, there's different antibodies that the mother produces that can act upon the infant in the womb. But like I said, that mom doesn't necessarily have to have lupus in order for there to be neonatal lupus. So how is lupus diagnosed? So one of the most difficult things about lupus is that there's not a set standard for how lupus is diagnosed. There are a lot of different things that doctors have to take into consideration in order to make that diagnosis. So a doctor will likely review current symptoms and your medical history and family history. A lot of people with lupus will see a rheumatologist, especially if it's systemic lupus. If you have skin involvement, cutaneous lupus, you'll likely see a dermatologist. Also, if there's, depending on what type of organ involvement you have, you may be seeing other specialists as well, such as a cardiologist for your heart, a nephrologist for your kidney. But when it comes to diagnosis, your rheumatologist is going to be key for a systemic diagnosis, and a dermatologist will be key for a cutaneous diagnosis. So there's not a single diagnostic test for lupus. Doctors will use a variety of tests to help them see a big picture of what's going on. And so, like I said, there's different tests and they're listed there. They'll use all of these different things to kind of put a puzzle together, and everything is a puzzle piece. And they'll use each of those puzzle pieces to get a big picture of what's going on once they start putting them together, including your symptoms, past symptoms that you have had, family history, and then those lab tests. In certain cases, they will also use tissue biopsies for diagnosis, especially in cases of cutaneous lupus. They'll do a biopsy, and they'll also do kidney biopsies when there's suspected kidney involvement as well for kidney nephritis, lupus nephritis, I'm sorry. So, as I mentioned, it's really difficult to diagnose lupus. So remember that the disease is so different for everyone. It's heterogeneous. So I used the example earlier that you could put 5 people in a room with lupus, and they could all have different symptoms and just really be affected differently by lupus. So that is one of the things that makes it hard to diagnose. And again, those symptoms really, they vary as far as whether, someone might have joint pain and someone else might only have a butterfly rash that appears every so often, and they can't really describe why or when. But those symptoms change over time as well. And so depending on that activity, what's going on, someone may not have symptoms for a while, and then all of a sudden they have a lot of symptoms that they just can't seem to do anything to alleviate. And that would be a time of flare where they have a lot of those symptoms going on. The symptoms of lupus are not very descriptive. So really those symptoms could appear in other diseases, and lupus symptoms do mimic other diseases. And as I mentioned, there's no single diagnostic test to diagnose lupus. So it's not like getting diagnosed with diabetes where you're going to get your A1C checked, and they're going to look at that, and they're going to look at your blood glucose. So there's not one single test that can diagnose lupus, unfortunately. And so that's really why it can require so much time and multiple visits in order to get that diagnosis, because it could depend on what types of symptoms you have going on. And if you don't have a lot of symptoms going on, your lab work may not look like there's a lot going on as well, depending on, when that lab work is taken. And so that's, again, it's important to seek specialists that are familiar with lupus, because they are familiar with those different puzzle pieces that need to be put together for that diagnosis. And that's really, a rheumatologist really is instrumental for a SLE diagnosis, because they are so familiar with lupus. So how is lupus treated? In many cases, the best treatment approach is to work with a healthcare team that will tailor a treatment to your specific condition or conditions. So if you have other underlying diseases, it's important to work with them and come up with a treatment plan that works best for you and your situation. And so that treatment plan should be based on your age, symptoms, general health, lifestyle. And the goals of any treatment plan should be to reduce inflammation caused by lupus, to suppress your overactive immune system. So yes, with lupus, your immune system is overactive, to prevent flares. So again, flares are disease or increases in disease activity at a period of time, and then to treat those flares when they do occur. A treatment plan should also work to control the symptoms that you're having, like joint pain and fatigue. And then, of course, you want to minimize the damage to the organs that can be done due to that inflammation. So today, physicians treat lupus using a wide variety of medications, and they range in strength from mild to extremely strong. Prescribed medications will usually change during a person's lifetime with lupus. However, it can take months, sometimes years, before your healthcare team finds just the right combination of medications to keep lupus symptoms under control. And so some people with lupus will take a cocktail of medications. They may not just take one medicine. They may have some type of combination that they found has worked the best for them. And so, treatment of lupus, again, kind of varies depending on organ systems involved with the disease. Treatment may be different from someone that has a lot of kidney involvement versus someone that may just have joint pain and fatigue. So we'll be looking at different treatment plans for them. There are a few FDA-approved therapies for lupus, including aspirin, which was FDA approved back in 1948. Corticosteroids, so we affectionately know them as steroids, including prednisone or some form of prednisone. They were approved by the FDA also in 1948. One of the more well-known treatments, and we've seen it in the news quite a bit recently, is Plaquenil, or you'll hear it referred to as hydroxychloroquine. And so that is an anti-malarial medication. We also have chloroquine and quinacrine. So those are kind of usually gold standards of a medication that someone with lupus will be put on, at least initially, for managing their disease. We also have Benlysta, and that was approved by the FDA recently in terms of medication approvals in 2011, and that was the first and only medication at the time to be approved for lupus-specific treatment. You can always follow, as I mentioned, we have Inside Lupus Research, so research is always ongoing for new therapies, and you can always see those latest updates at lupus.org/research. There are also some other commonly prescribed medications, such as non-steroidal anti-inflammatory medications, ibuprofen, acetaminophen. There are also immunosuppressive medications, like cytotoxin, Imuron. So those medications can be used as well. And then depending on what's going on, some people may also need anticoagulants such as heparin and warfarin. So Coumadin, you may know it by that name as well. So those medications may also be prescribed in addition to the anti-malarials, the Benlysta, the steroids. The goal is to hopefully be on some type of medication that limits the need for steroids long term, since steroids can do so much damage to the body at high doses for a long time. There's also lifestyle considerations. So medications are, of course, important to make sure that we're minimizing that inflammation in the body. And we should be taking that medication as often as prescribed and as prescribed. But there are also triggers that someone with lupus should avoid. So I talked about that photosensitivity earlier. And so we want to make sure that someone with lupus is avoiding the sun, those UV rays from the sun, or even fluorescent light bulbs, since they can also produce UV light as well. Even someone that may say, well, I don't get the butterfly rash, the sun doesn't bother me. They may have joint pain a week later after a significant amount of time of UV exposure and may not be able to link those two. So it's always important for someone with lupus to try to avoid sun exposure. And if you do have to be out, try to limit your exposure time, wear protective clothing, hats, and of course sunscreen. Other triggers can be certain types of medications, such as sulfa drugs for some lupus patients, infections. So if you were to get, some type of virus, cold, that could stress the body out, that could also cause a flare for the person. Stress, smoking. So all of those things really can kind of trigger a flare for a lupus patient. Anything that causes stress to the body, whether it be emotional or physical, even including potentially surgeries, could be a trigger. It's important to describe all symptoms, all new symptoms, to your doctor as well, because those symptoms, you may need to have your medications changed, or those medications could be causing those symptoms. Or it could just be that you may have a flare, but either way, it's important to describe those symptoms so that your doctor has an idea of what's going on, and so that they know if there's something that might need to be changed with your treatment plan. We also, everyone, not just someone with lupus, should eat a balanced diet. There's not a specific lupus diet, but you should try to eat a nutritious, well-balanced, and varied diet that contains plenty of fresh fruits and vegetables, whole grains, and you want to make sure that we're limiting those amounts of meat, especially red meat. Fish is good, right? So we want to make sure that we're having those moderate amounts of meats and protein that we should be having, and getting plenty of rest and exercise. And yes, we need plenty of both of those things. So people that don't get enough sleep can be at risk for increases of inflammation in the body. So for people with lupus, that extra inflammation can worsen symptoms such as fatigue, pain, feeling depressed, having poor attention, poor concentration, and can even affect mental processing speed and memory. I think we all know that exercise is an important way to take care of ourselves, and it really does have so many physical, emotional, and social benefits. I know that it's a little hard right now, but I think people, I've seen a lot more people out walking around in the neighborhood, and I think that's so wonderful just to be able to be a little bit outside and getting some movement. I also mentioned smoking. So we know that smoking has a whole host of different health issues that go along with it. But it can really affect lupus and can just really make some existing problems from lupus, can make them far worse. And it can also potentially lower the effectiveness of medications used to treat lupus. So really just can cause some different complications. And that is all I have today. So thank you so much for attending. And Carla, thank you so much for giving us this opportunity to speak today.
Thank you so much for a wonderful presentation, Ashley. And I think it was a great example of not only how much information the Lupus Foundation of America has, but more than anything, how approachable everyone is and how easy it is, how you can make what can sometimes feel like an overwhelming topic. Really, you break it down into bite-sized chunks so people not only understand what it is, but can take actionable steps to feel better if themselves or their loved ones or a client or patient is struggling with this diagnosis. And I always learn something new. So thanks everybody for taking time to join us. And a reminder that if you do have questions, I do see some coming in for Ashley. Again, you can type them into that question section of your GoToWebinar control panel. As those questions are coming in, I want to take a moment to remind everybody that NeedyMeds is here to support you if you are having trouble affording your medications or other healthcare expenses. What you're looking at on the screen are some of our most popular ways to save on your healthcare costs, and you can find all of those under that patient savings tab that I pointed out in the beginning of the presentation. As promised, I want to leave up the contact information for the Lupus Foundation of America, as well as for NeedyMeds, should you have any questions moving forward. And I will take the liberty of speaking for Ashley and the Lupus Foundation of America that they and NeedyMeds do hope that you keep in touch with us. And Ashley highlighted a bunch of ways in the beginning of the presentation to stay involved. So with that, let's go ahead and get to some of those questions coming in. So the first one is, and I'm sure you get this all the time, so I'm glad somebody's asking it. My doctor says I don't have lupus because I don't have the butterfly rash. Is that true?
We do get that more than you probably would think. So while the butterfly rash is one of the most common symptoms people associate with lupus, it certainly does not need to be present to be diagnosed with lupus. And in fact, about half of all lupus patients will experience that rash, but they may not. And that rash can occur spontaneously. It could occur after sun exposure. So in short, no, you don't have to have a butterfly rash in order to be diagnosed with lupus. The doctor should be taking a look at other factors, other symptoms that you have that can be associated with lupus. Your medical history, your family history, and then looking at those lab tests and coming to a diagnosis, not just focusing on that one single symptom that you may or may not have.
Thank you so much. That's an important question. And it actually leads us perfectly into another question that came in, which is, so what should I do if I suspect I have lupus? What's the first step?
Okay, so a couple of different things. So I mentioned it can be somewhat difficult to get a lupus diagnosis. So there's a couple of different things that I recommend everyone do that suspects they have lupus. And the first would be to educate yourself about lupus. And I think many of you have already taken that first step. You're attending, you got some information. But go out there, go visit our National Resource Center on lupus and read a lot of information about lupus and get a good understanding of it. And then I would also recommend keeping track of your symptoms. So those symptoms are so important. And we also have a symptom tracker out on our website. But keep track of them. Keep a symptom journal. Talk about what symptoms you have. If you can link them to anything that might be triggering them, whether it be sun exposure or something, keep track of that because you'll want to be able to communicate those symptoms with your doctor. And by having a symptom journal, you'll be able to talk about how frequently they occur, when they occur, and you won't have to recall all of it from memory. I know sometimes we get in there in front of the doctor and we get pressed for time, and we might be a little bit more forgetful just because of the environment we're in. So if we have a recorded document, it's really helpful when you get in there. And then I mentioned this, but see a rheumatologist or get a second opinion. A rheumatologist can help determine if you have lupus. And if you currently have a rheumatologist, you can consider getting a second opinion or even going to a rheumatology clinic associated with a medical school. And I always stress this, even if your symptoms may not be related to lupus, it's important to find a doctor that listens to your concerns and works to determine the cause of those symptoms. Even if they are working to figure out what it is, and maybe they're ruling things out, as long as they're working with you to determine what those symptoms are being caused by, I think that's really important.
Thanks so much for the question, because it's an important one, and thank you so much for the thorough response, Ashley. It actually is prompting me to mention two quick things to our audience. First of all, Ashley talked about how important it is to journal and track your symptoms. One of the things I just want to take a moment to point out, if we return to the NeedyMeds website, on the bottom left-hand side, we're working to replace this image, you'll see a link for something called Health Storylines. And Health Storylines is a free self-care app that makes it possible to track and manage your health conditions. And it works, again, it's a customizable self-care app, and it can do all of these things for you. It can be a medication reminder, a symptom tracker, but it does also have a journal in it. So that's really important. And this is free. It does have the NeedyMeds drug discount card also preloaded, and you can download it, again, for free, either through Google Play or the iTunes App Store. So I wanted to take a moment to mention that. Also, Ashley talked about the importance of speaking with and visiting with a doctor or primary care physician that is hearing you. Ashley actually has previously, for NeedyMeds, given a webinar on how to prepare for your doctor's appointment. And so you might be interested in checking that out. And how you can do that is visit our YouTube channel. And again, that's the right-hand, it's on the right-hand top of our page. Click on the videos, and you can look for it in here by typing it into this this search bar right here. But I also will encourage you to check out other of our recently recorded webinars in case you missed out on them. So thank you so much for bringing that up, and I hope those two little tips help. And actually, you talked about going to a rheumatologist, which leads also into another question that came in, which is, what type of doctor can diagnose lupus?
Okay, so if many signs and symptoms are present, a diagnosis of lupus may be made by really just about any type of doctor, including a family practitioner, an internist, or an internal medicine doctor. I also talked about dermatologists, especially for skin lupus, cutaneous lupus. A dermatologist is also important, or even a pediatrician. But as is often the case, those symptoms really tend to develop gradually over time, so the diagnosis may not be as obvious. So that's why it's really important to see a rheumatologist. Even a lot of times we'll hear from people that their general practitioner, family practitioner believes they have lupus, based on the symptoms and lab work. A lot of times they will still refer that individual to a rheumatologist for a definitive diagnosis. And that's just because the rheumatologist really is a specialist in that area and for lupus. And even if your primary care physician does have that inclination to say that you have lupus, they may not be as educated or as knowledgeable about the treatments that are available for lupus. And so that's why a lot of times people with lupus will see a board certified rheumatologist. Or, as I mentioned, in the case of cutaneous or skin lupus, a lot of times that would be that dermatologist that you would be seeing.
Thank you so much. And that's another important question. And we do have a bunch of questions also coming in. I will give the audience the heads up that we won't have the chance to get to everyone's question. And I will remind you, you can feel free to visit Lupus, visit the Lupus Foundation of America website that's on your screen now. Give them an email, but we will respond to you via email as well. And I'm going to wrap it up with these. There's sort of two questions that are related, which is, how long will a flare typically last, and how long does remission typically last?
That's a really good question. And if you guys will recall, I mentioned a lot of this. So lupus is really dependent on the person, right? So it's frequently said that the only predictable thing about lupus is its unpredictability. So there's really not a way to predict how long a flare may last or how long remission will last, because lupus affects everyone so differently. For some people, they may be in a chronic flare for a really long time, whereas others may be in remission for the majority of the time. So again, the goal of treatment plan would be hopefully to find a treatment that works really well for you, can minimize those flares, and keeps you in remission for a good amount of time. But again, there may be a trigger that is out of your hands that could trigger that flare, and that flare may only last a short amount of time, where it could last a couple of weeks. It really is dependent upon the person.
Thank you again, Ashley, for another thorough response. And it really, I think one of the things that this webinar drives home is that, as you said, because lupus can be cruel and also unpredictable, a great first step is getting reliable information and really educating yourself. And that's why we are so proud to partner with the Lupus Foundation of America, because not only are they reputable, but they have accurate and up-to-date information and do their best to connect with people living with this diagnosis. As I said, we're going to wrap up that portion of the, we usually do keep this question segment pretty brief. So we're going to go ahead and wrap it up. Again, if you didn't get a chance to have your question answered, you can reach out to Lupus or NeedyMeds, but we will respond to you as well via email. With that, I want to thank Ashley for taking time out of her day to share her expertise with the NeedyMeds audience. And to our audience, thanks so much for taking time out of your day to join us. I do hope I see your names and email addresses pop up for future webinars. Don't hesitate to reach out to me with any questions. My email address is carla@needymeds.com. Carla at NeedyMeds. Thank you so much. Thanks, everybody, and do stay in touch and stay safe. Thanks, Ashley. Thanks, everybody. Take care.